Hello, my name is Erin King. I'm a nursing student with Indiana State University. This presentation, titled Do Your Loved Ones Know Your Wishes?, is about the importance of advance directives. The population at risk for this presentation is adults ages 18 and over. The presentation's learning objectives. At the conclusion of this activity, participants will be able to recognize the importance of advanced care planning and evaluate their own plan, define advance directive, and give examples of different types of them. Begin to develop their own ideas for what their advanced care planning looks like. Utilize the internet resources provided for additional tools and to complete forms for their state. At this time in the presentation, I ask that you pause the presentation and take the linked PreTest. What is advanced care planning? Advanced care planning helps guide family or friends making difficult decisions on behalf of their loved one in regards to medical intervention in a medical emergency. During this process, individuals typically complete an advance directive, which is a legal document that highlights a patient's healthcare wishes if they become incapacitated or no longer able to make decisions on their own. Currently, there are multiple different options for patients when completing an advance directive, and all states have some form of living will and advance directive laws. Types of advance directives. Living will. A living will allows individuals to decide what life-saving measures they want if they're unable to make decisions on their own. This includes being incapacitated, such as in a coma, or also advanced forms of dementia where they're no longer mentally stable enough to make decisions on their own. A durable power of attorney for healthcare, also known as healthcare power of attorney, is appointed by the patient to make decisions for them when they're in this state. So this may be a person that is a family member or friend that is predetermined by the patient long before they become incapacitated. Having both a living will and a healthcare power of attorney includes appointing this decision maker and listing which life-saving measures would be desired in a healthcare crisis. It also lists what would not be desired. A POST, MOST, or MOST form, which is an acronym for Physician's Ordered Life-Sustaining Form, Medical Orders for Life-Sustaining Treatment Form, or Medical Orders for Treatment Forms, and that depends on the state. These are more specific and direct healthcare providers to the type of treatment that a plan wishes or does not wish to receive in certain life scenarios. These are just a couple examples of what the different types of forms may look like. On the left is a MOST form from the state of Colorado. It outlines specific parts of treatments and interventions that a patient does or does not want in critical situations. On the right is what's known as a DDNR form, and this is from the state of Virginia. Each state has their own forms, and they may be called something different. For instance, in North Carolina, it is called a MOST form, but it is called a DNR form. They all have very similar purpose behind them, but they may be called something different. So it is important to know the state that you live in, what they're called. More specifically, what is found on a POST, MOST, or MOST form? Again, each state is very specific to what is on their individual forms. However, it typically includes resuscitation, ventilation, and hospitalization at a very minimum. The questions specify whether a patient wants to be resuscitated, wants ventilation, or wants hospitalization to occur in critical or life-threatening situations. Other states include things such as if they are nearing the end of life, do they want antibiotics if it's something that is indicated? Do they want IV fluids? Do they want tube feedings? So as I said before, each state is very different in what is listed on these forms, but the top three, resuscitation, ventilation, and hospitalization, are typically on all states' most forms. So at this point in the presentation, if you're 18 to mid-50s, you're probably asking yourself, I'm not sick, so why should I fill out these advanced directives? The best time to complete advanced directives is when you're healthy. Imagine being a loved one and anticipating the potential loss of a loved one, all while having to make healthcare decisions on their behalf. Families are often worried about not knowing what the patient wants and what preferences to treatment would be, and they often are worried about making the wrong decisions. A lot of times this can cause ethical dilemmas. Patients are not in an ideal state of mind to make decisions in a time of crisis. Trying to complete an advanced directive during this time makes it no longer an advanced directive, but a crisis directive. It's extremely important to make sure that your family and friends know what you would want in certain situations of a medical crisis, so that they are not left with the burden of making that decision for you. It's important to advocate for yourself prior to an emergency by completing advanced directives while you're young and healthy. There are several internet resources for advanced directives out there. And if you're a healthy individual, aging or end of life may not be something you've thought about. However, Aging with Dignity is a nonprofit organization that has made being an advocate for quality care for those near end of life its primary mission. This group is a trusted resource for those wanting to plan for care in advance of a health crisis. They have excellent resources, including a tool that is called 5 Wishes. This resource is written in everyday language. It provides many talking points throughout the booklet. The talking points help to open up the discussion about wants, desires, and needs with end-of-life issues. So if you're unsure about what your wants and needs would be, this is a great place to start. Another excellent internet resource is EverPlans, which is a website that provides an easy search for forms, advanced care directives, and healthcare proxy forms for each state. Thank you for viewing my presentation today. I hope that you will use the internet resources provided to do some research on your end-of-life options, as well as develop a plan for your advanced care planning. Please take the PostTest and see what you've learned today. There are many options out there for you to plan so that your family will not be burdened with making decisions for you. It's important to advocate for yourself before you're in a healthcare crisis.